Business as usual is quite unusual in 2021. Some companies are busier than ever, endeavoring to keep up with demand. Others long for a return of a rush, of a full house, of the simple ability to stand shoulder to shoulder. The COVID-19 pandemic has changed the way we do business. Some of those changes may be permanent. Some may go away in the near future. Unfortunately, for now, there's a lot we don't know. The challenges are many, and not all of them can be blamed on a virus. Housing shortages, workforce gaps, inequality. A variety of social and economic issues challenged us before the pandemic reached the Lilac City. But we are Spokane. We are Coeur d'Alene. We are the Inland Northwest. We are nothing if not caring, resilient, and resourceful. At the Journal of Business, we endeavor to keep you, our readers, informed on what's happening in your community. Our staff is dedicated to providing you with objective information on news and trends, with the goal of ultimately helping you to be more successful in your chosen path. It's time to go beyond sound bites. It's time for more depth than 140 characters can provide. It's time for elevating the conversation.
Well, good afternoon and welcome. My name is Paul Reed, and I'm privileged to serve as publisher of the Journal of Business. This is the second of a new series we launched last month called Elevating the Conversation. And as Lynn Parrish, our editor, suggested in the video you just saw, our goal of this series is quite simple: to create an environment in which we can have important discussions in our community about opportunities and challenges. Last month, we were lucky to have Stephanie Curran, CEO of the Spokane Public Facilities District, as our guest for a great discussion about the event industry in a very, very challenging time. Next month, we have NAACP President Keonta Duncan for a conversation about diversity and inclusion in a mostly white community. In April, we're happy to have Jim Frank, founder of Greenstone Homes, talking about affordability and availability amidst a housing crisis. And in May, we're grateful to have Steve Scranton, economist at Washington Trust Bank, giving us a mid-year economic report and a look ahead in a post-pandemic economy. Well, we hope, right? I hope you join us for each of those conversations, and plus 7 more. And you can learn about all of them by visiting our website, spokanejournal.com/events. But today I'm especially pleased to have with us Dr. Frank Velázquez of Spokane Regional Health District. We'll let Lynn introduce him a little bit more in a few minutes, but because I'm not in the newsroom, I can editorialize. We owe Frank a great deal of gratitude for stepping up to a challenge the community really wanted him to take on, just because he wanted to help. So welcome, Frank. We really appreciate you being with us today. But first, we don't get to do these things without the support of our sponsors. And I'm truly thankful today to recognize February sponsor, Providence Healthcare. Providence Healthcare is not only a long-time large employer in our community, but it also has been loyal, very loyal about supporting community conversations like this. Thank you, Providence Healthcare, for once again stepping up. And because we are in a pandemic and we do most everything virtually now, our sponsor message is taped. Here's a message from Providence Healthcare. Let's take a look.
To our caregivers, our kindness givers, our hope givers, our givers of hard work and compassion. To everyone giving it their everything, thank you.
Yes, we are all giving it our everything. To those on the front lines of this pandemic, to the business organizations, business owners, and your employees, to our healthcare partners, to all who are giving it their everything, we thank you. Hi, I'm Peg Curry, Chief Operating Officer for Providence Healthcare. Providence extends a special thanks to the Spokane Journal of Business team for their tireless work in keeping the business community informed. spotlighting the good news and supporting our businesses under such challenging and changing times. The work they've done through the pandemic is just another example of how our Spokane business community has rallied around one another. It has not been easy, but we've seen so many creative ways to stay open and provide the services we love and miss. You continue to provide innovative ways for people to work and shop local. Thank you all for doing your part to adopt safety protocols to ensure both employees and customers are as safe as possible. Your innovation and determination are what make this such a great place to live, work, and play. As your healthcare partner, we urge you all to continue to support each other and keep those safety measures in place so we can continue to see this great downward trend in cases. We need to give all amazing healthcare providers and all who work in Spokane hospitals and clinics a chance to catch their collective breath from the very difficult year we all just experienced. And this pandemic is still not over yet. So let's stay healthy so we can get on that fast track back to our new normal. We have a real sense of hope in the COVID vaccine. As we see the vaccine roll out, we know we're actively fighting this virus. At Providence, we've been able to help vaccinate our caregivers and our community. When you have the opportunity, please consider getting the vaccine yourselves. We are looking forward to hearing from Dr. Velázquez and thank him for his leadership. On behalf of Providence, we wish you peace, prosperity, and health.
Welcome to Elevating the Conversation. My name is Lynn Parrish. I am the editor of the Journal of Business. And more importantly, the gentleman to my right is Dr. Francisco Velázquez, interim health officer for the Spokane Regional Health District and longtime healthcare executive here in Spokane. Welcome, Dr. Velázquez.
Well, thank you, Len. Happy to be here. It's a great day to be in Spokane.
I would concur. So we're going to get into talking about vaccines, pandemic, and a few other things here real quick. Before we do, I want to tell our viewers we have a question and answer option on Zoom where you can ask questions that we will talk to or present to Dr. Velázquez at the end of our conversation. So please use that and help us make this an interesting dialogue. I guess the first question I'd have is, or the best thing that we should talk about first is, where are we in terms of vaccination right now? And how does it compare to other communities?
That's a very good question. Actually, first of all, I do want to say thank you to all of our clinical partners because it has been a community effort. We are doing really well in terms of percentage of our population that has been immunized, either with a first dose or both doses, as compared to the rest of the state. We are at par with some of the other larger counties and actually doing very well for the amount of vaccine that we have been receiving. So I do want to emphasize that because it's been a community-wide effort. All of our clinical partners, all our providers, CHAS, and many others, including the Spokane Regional Health District, have been working really hard. As an example, we at the Spokane Regional Health District have already passed the 10,000 mark for immunizations, and we have been focused on long-term care facilities, schools, and other high-risk areas such as correctional facilities and shelters, et cetera. We don't focus on the clinical side of the equation. That's where our clinical partners spend their efforts. So as a community, I think we've done a great effort. And I will end that point by saying that we do have the capacity of doing more. So if anybody out there is listening and wants to send us more vaccine, we'll be happy to take care of it.
I bet you would. I bet you would. Now, what is it about the Spokane market that makes it more challenging for vaccines? We've talked in the past about having maybe a larger senior population than some metropolitan areas in Washington.
So I think the Spokane area is very unique for a mid-sized city. And the reason for that is we have a high density of healthcare. because we're a regional referral center. That means we have more healthcare providers of all types than other communities our size. So when we look at the early stages of immunization, the tier 1A, where we have all of our healthcare providers, as well as first responders, we have thousands upon thousands as compared to other communities. So to get through all of that is was a little bit of a challenge just because of the number versus the amount of vaccine. Then we're very attractive for those that are thinking about maybe retiring at some point or moving to a place that has a high quality of life. So when you look at the population of in Spokane of over 65 is also very high. And that's where we're at now, the over 65 and those over 50 in multi-generational environments. So we do have a large number of both, but I think we're doing really well with both groups.
Great, great. What do you see as what are your short-term projections in terms of vaccination? What do you see happening over the next, and I'll let you decide the term, a month through the spring in terms of vaccination numbers?
So I think there's a few things that we need to think about. The first one is for Washington State, the allocation of vaccine seems to be increasing every couple of weeks, which I think is good, because our allocation is dependent upon how much the state gets. So example, 3 weeks ago, 3-4 weeks ago, we're getting about 30% of whatever amount we were requesting. In the last few weeks, we've been getting 46, 47, 48%, and we keep moving forward. So that's number one. I think number two, we have 2 vaccines right now, and we're hoping for the third one soon, which will give us one additional tool. And that additional tool, if indeed the FDA provides emergency use authorization, is a single dose vaccine that can be stored at standard refrigerator temperature, which will allow us to move it to many other places where the access is a little bit more complicated because of that. So I think we will keep increasing. The governor has set a goal of 45,000 immunizations a day. In the state, we're doing about 27,000, close to 28,000. I think we will get to the 45. So when that happens, between now and the late spring, early summer, our goal is to have immunized as many of the people that want and qualify if the supply chain continues. So that's what we're looking to. And the more vaccine we get, the more effectively we'll be able to do that, because we have the potential for deploying a lot more. Just to give you another number, through the Spokane Regional Health District, we activated our Medical Reserve Corps. A lot of them are retired providers, and we have over 400 volunteers ready to go. That's a whole army.
So put another way, would you say that by late spring, early summer, anybody who wants to be able to get a vaccine should be able to get one?
I think we should be looking at the summer for that projection. And the reason for that is because we're going to we need to move a little bit slowly in the early phases because of the sheer numbers of people that are involved in the categories that we're looking at. And if you look at the national projections, they're saying summer for more readily available vaccine. For example, Johnson & Johnson has committed to about 100 million doses by June, only about 20 million over the next 4 to 8 weeks if they do get emergency use authorization. So ramping up the production is key.
Right. We talk a lot about herd immunity in this arena. I'm curious to know, are there other milestones we should be looking for between where we are now and herd immunity?
So I think one of the things that we need to look at, and this is good news for Spokane right now, if you look at our rate of positive cases per 100,000, we've been steadily moving in the right direction. And what I mean the right direction, I mean lower. But I'm always careful not to say it's improving significantly, because I don't want us to not be diligent. So we're moving in the right direction, and that's a number that we need to keep tracking, and as well as the number of people in the hospital and the number of people that are in the ICUs, because that tells us that transmission is decreasing if you look at those. So when we compare that with immunization and then the improved testing that we're going to continue doing, over the next several months, many months, we're going to be doing additional testing. Those three together are the three tools to manage the pandemic into the future. So if we're diligent and stay really on task, I think we will do well. That's just my own prediction with one caveat, which I'm sure we're going to talk about, which is there are some variants of the virus that we're watching very closely.
Sure, sure. So I'm curious to know, can you or would you link the trends in the number of cases to the vaccination efforts at this point?
So if you look around the country and you look here, we have not reached a percentage high enough for that to be the most significant factor. It is certainly a contributing factor, as is the fact that we do have some people with natural immunity because they have been exposed. But the single most important factor impacting that is actually we, the people, following the public health guidance.
Sure.
The facial coverings, the hand washing, social distancing, not congregating. And the reason why I say that is because we've seen our numbers improve, but more importantly, we've seen our numbers improve in some of the groups that initially were at a higher risk of transmission, such as younger people between 20 and 39, that were more than 40%, high 40% of the total numbers. Now they're down in 15, maybe 30% total. So they're taking this very seriously. And if we continue doing that, we should continue to see those numbers improve.
Interesting, interesting. What does herd immunity look like to you?
So if you look at all the literature, and it varies by virus, with this one, we should be looking at in the 80+% of everyone with antibodies, vaccine or naturally occurring antibodies. With this particular virus, we're not going to get to herd immunity just by letting people transmit the virus. We're going to get to herd immunity by immunization. And that's a little bit different than perhaps all the diseases we've seen in the past. That's why immunization is so important. It will get us there. The purpose of herd immunity is to deny the virus a new host. And vaccines are going to help us do that.
Do we have any sense at this point how long a vaccine will be effective?
So the vaccines, when they were initially being released, there were several numbers that were published. But we do believe that now you're looking at many months, and it's been said up to between 1 and 3 years, with one caveat, which is based on the wild type of the native virus. I'm sure that the variants will change that. The same with the flu. Every year we have a slightly modified vaccine to address the most common variants. I'm sure that with COVID, we'll probably have to do the same over time. But the vaccines work and work very well and do confer significant immunity. Just remember, though, that they are not 100%. No vaccine is. So they protect you from the worst cases of disease and protect you in many ways from the transmission, but it's not 100%. You can still catch it, which is the reason why, even if you're immunized, you still have to follow the public health guidance.
Sure. Do you see a day coming or in the future, do you think we will be getting an annual COVID-19 shot in addition to the flu shot, or do you not? Or is it not going to go that way?
Well, it seems just based on how efficient this virus seems to be. And what I mean by that is if you just look at the mutations that have changed the biology to make it a more effective transfer and more effective at transmission, it is conceivable that the virus may be around for a very long period of time. In which case, I will envision us maybe getting a booster shot like we do for the flu, either every year, every other year, or with a defined frequency.
Sure, sure. We talk a little bit about, as a society, going back to normal. When do you see something like that being possible?
And this is why I have to be very careful not to speculate. But if you look at many of the predictions and some of the modeling, sometime later this year, a lot of people say fall. We should have a lot more activity than what we have now. The summer is still a little bit questionable because of the entry of the variants in the picture. But if we immunize, do a lot more testing, deployable testing, particularly such as antigen testing, like they do in higher education, and follow the public health guidance for the next few months, I think there is light at the end of the tunnel for sure.
Sure, sure. Do you think it's possible that if we were doing this a year from now, we might be able to do it without masks?
Good question. I think we all hope that that is the case. We need to see what happens between now and the summer of this year, because that will tell us what the next 6 to 12 months may look like. I think we all hope that we don't. I'm not a big fan of wearing masks, actually, but I do it because it's my duty and I'm happy to do it.
Sure, sure. I feel the same way. And you touched on this a little bit, but I wanted to ask, we have kids in school now, going back more. We have people in restaurants again, at a reduced capacity. And I'm just curious, Dr. Velázquez, how comfortable are you with the level of activity that is permitted at this point?
Good question. And if you think about it, we have worked very closely with the school districts and our school partners and have not only a lot of history and outcomes with them, but also have a very close relationship, which is one of the reasons why we provided them with a line of sight for this academic year, which is how we're onboarding students back in a very measured way. And that's very important to remember. This is a very measured, stepwise way in which there are outcomes and requirements that need to be met for each one of those. And it was important for us to bring back young learners and students. If you look at the negative outcomes of not being in school, such as depression, anxiety, suicidal thoughts, substance abuse, children that are not getting the support that they need, children that are not getting the support with medication that they need, or food insecurity. So we needed to really push on doing that, and we've done that. And if you look at the numbers, they're fairly low compared to the number of students we have back. So that's number one. Number two, the community continues to work very hard at being diligent. And how do I know that? Because we spend a lot of time talking to the business owners, the restaurant owners, those that have facilities, and we're in constant communication. So if we continue doing that, I think the level of activity will be not only a good for the community to have, but also something that we can learn from and maybe improve upon.
Sure. We've already learned a lot, would you say?
I think we've learned a lot. I can tell you when I joined the agency, I was my first presentation, I said, we're looking forward to vaccines. And here I am now saying we've surpassed the 10,000 mark just at the district.
Great. I want to remind our viewers that we'll be taking questions for Dr. Velázquez and presenting those to him shortly. So please feel free to type in any questions that you have for our guest today. You know, you brought up being new to the health district, certainly not new to healthcare or public health. But I did want to ask you about how this position fits in with your career in medicine.
Sure. And actually, for me, this is almost full circle. So I started way back when, and I won't tell you when, that was a few years ago, in the Boston area in the middle of the HIV epidemic. And one of my duties was to counsel those that were positive, which at that point in time, it was a deadly disease. We have moved forward in over 30 years to treat it as a chronic illness, which is great progress. So I spent a lot of time taking care of patients. I also spent a lot of time teaching. I've held academic executive appointments in 5 different medical schools. I'm a full clinical professor and former academic chair, so a fair amount of research in those areas. Pivoted a little bit after doing a master's of healthcare management and policy at Harvard School of Public Health. And the reason for that entity was the focus on public health and policy, which was consistent with my own career. Run 3 companies. One of them, an infectious disease company, actually, and we, manufacturing arm of our company, developed the H1N1, the first test. So I've been around epidemics and pandemics and infectious diseases for quite some time. So this brought me back full circle, close to where I started, over 35 years later. Now, I highlight that because a lot of people know me in the shortest of my careers, which was as an executive. I was, say I ran 3 companies. I was CEO for probably about 12, 13 years, but I've been a physician for about 40. So that's the biggest chunk of my career. And this brought me back to the beginning, back into public health.
Sure, sure. I kind of glossed over variants earlier,
Mhm.
and you had mentioned it several times during your comments. What do we know about the variants at this point, and how does it fit in with the strategies that you're employing?
Good question. We know that there are 3 that are significant, and what that means is the mutations that make the virus more effective as an infectious agent, and that's why we worry about it. Because technically, there are 12,000 mutations in this particular virus that have been described since the beginning, but we only focus on those that improve the biological activity of the virus. There's 2 of them that have been already identified in the state of Washington. We have not identified any in Spokane, but the fact that already in the state tells me that they will probably move forward. I think there's only 6 states in the country that don't have any of the variants at this point. So it's a matter of time. And the reason why I bring those up is because they're more effective at transmitting, and they're more effective at generating a higher viral load. So if we relax any of the public health measures we have now, what we're doing is we're making it easier for that more effective virus to take hold in the community. So that's why I bring it up, because now it's, despite the fact that our numbers are better and we're immunizing lots of people, now is not the time to relax. Now is the time to really be diligent so we can deny the variants a foothold in the community.
Sure, sure. That makes a lot of sense. Would you have any advice for business owners who are trying to navigate this at this point?
I do. And a couple of things I think is important for business owners to remember. First of all, we're here. And when I say we, I mean the Spokane Regional Health District. And we have a team dedicated to work with businesses of all kinds. And we do that. We've done since, for the last 6 months or so, we've done thousands of consultations. So that's number 1. We're a resource. Number 2, we're here to help you. And if there's any information that you need that you can't find or don't know what to do with, that's where we come in. Although we continue moving information into the community, that's number 1. Number 2, I think all businesses of all sizes should think about an immunization strategy, okay? Because it will be a point in time in the near future where we will have a lot more vaccines. So many age groups, if not all age groups, will be could actually elect to get their vaccinations. That's number 2. And then number 3, I know it's been hard. I know it's been difficult, but don't despair. There's light at the end of the tunnel. And if we keep working together as we have, we will make it through, and we will make it through this. I am very confident we'll make it through it. It's unfortunate that some businesses have had a very difficult time, and we feel for them and we feel for the people. But let's keep moving forward. This virus is not going to defeat us.
Great, great. What do you think? You think it's time for a few questions from the?
Oh, absolutely. Only if I like the question.
Sure, sure. So let's see. I have the first one here from Nancy Voorhees. Says, why does the vaccine have to go through the state health department before it comes to the facilities?
Good question. Hi, Nancy. So the way the vaccine acquisition process works is the federal government acquires the vaccine through the CDC. That gets allocated to the state through the Department of Health. That's true of every state. We're not an exception. It goes to the Department of Health. And then the Department of Health allocates the vaccine to providers. And I'm glad you asked that, because the Spokane Regional Health District, we're a provider, the same way that Multicare, Chas, or Providence. So we have to stand in line too. And that is the way the process has been set at the federal government level and the state level. Now, the only exception to that is there's a direct supply to some of the pharmacies and others on their federal agreement. That is the way the process was designed. And we're doing our best to make it work the best way that we can. And there's been some lessons learned, but I do believe it's improving. And I can tell you, every dose that gets to the state rolls out to all of the providers.
Sure. Let's see what else we've got. Jan Wygan asks, what is the impact of anti-vaxxers? Oh, I'm sorry. Oh, I guess that question went away. Oops. I have Lee Tate asking, how confident are you that the vaccine does not contain dominant viruses?
Oh, I'm very confident on that one. So let me answer that one. And
Sure.
let me answer the other one, sort of. So there's always some vaccine hesitancy in many groups.
Sure.
Whether it's age groups, demographic groups, or groups that have either historical and cultural biases. For example, after this presentation, I'm going to do a presentation that is being sponsored by Latinos in Spokane, because younger Hispanics and those that are essential workers have a higher level of hesitancy than those that are over 50 with the same background. So the best way to address that is by having these conversations and making as much information available. The vaccines are safe. Both the Moderna and the Pfizer vaccine that are available contain no virus. This is a laboratory-created messenger RNA that has no virus, so you can't get the disease from the vaccines at all. All you get, which is a good thing, is a strong immune response for your body that is reacting to the glycoproteins that your own body is making under the direction of this messenger RNA.
Yeah. So I've heard that the second dose could really knock people off their feet for a day or so. Is that something you're saying?
Well, so by the time you get your second dose, it's a booster shot. So your immune system is going to go into hyperdrive if it's working well, which is a good thing. And I can tell you, if you look at the symptoms by frequency, pain in the injection site and redness around it is probably still the number one symptom by far. Some people may spike a fever for 24 hours or so. And particularly younger people whose immune system is very reactive, we do hear that they feel a little bit out of it for 24 to 36 hours. And it's not that they're getting sick, that's their immune system in hyperdrive. So we do hear that. The good news is the potential for severe reactions, such as anaphylactic shock or severe allergic reactions, is very, very low. It's between 2 and 6 per million for either one of the two vaccines. So we haven't, in Spokane, we haven't, knock on wood, haven't seen that. The good news is all of our providers are ready. Example, when we were working at the arena with Chaz, and still happens now, we have the EMTs on site. So that is, vaccines are safe. We do advise that if you have, for example, a company, well, don't send everybody to get immunized the same day, in case some people do feel a little bit out of sorts, stagger them out. And that's what we've done with the healthcare providers, the first responders and all this. We kind of like stagger a little bit.
Sure. The second part of Jan's question is about people who don't wear masks. What is your impression on resistance to wearing masks in the Spokane community at this point?
So I do have to say, because I go around and look actually, and I do see the vast majority of people wearing masks. I see the occasional one that isn't, which is typically businesses are doing a good job of saying you must wear your mask. It's a requirement. It's not an optional, unless you have a medical condition that doesn't allow that, in which case most businesses have alternatives like face shields and other things. So I do think people, we've gotten used to it. We're trying our best, and I will encourage people to try our best. And if you don't think that masks work, well, there's plenty of literature that will show the opposite. I have a corollary example. Our flu this year has been basically non-existent. Why? Because we're all following public health guidance, being very diligent about wearing masks, etc. Before COVID, during flu season, if you went to the doctor and you had a fever or a cough or whatever, you had to wear a mask. If you went to visit a cancer patient, you had to wear. So we've done it before. Now we just have to do it all the time.
Sure, sure. Did we answer Lee's question about dominant viruses that are present in animal tissue? Where the virus is grown? So the full question is, how confident are you that the vaccine does not contain dormant viruses that are present in the animal tissue where the vaccine is grown?
We're very confident because there's no virus. Again, we're engineering the messenger RNA, and even the like the Johnson & Johnson vaccine, which is on a messenger RNA, is we're using an adenovirus, which is a common cold virus, not the COVID virus. So we're very confident that there's no quote unquote COVID-19 or SARS-CoV-2, which is the actual virus in those vaccines. We're very confident of that.
Interesting, interesting. Let's see if we have the other questions. We have Sulani Matson asking, she says, variants may be more transmissible, but are they more deadly or more likely to cause symptomatic reactions?
Very good question. So we do know that the variants, particularly B.1.1.7, which is the most common one, and we do predict that will be the most common one over the next few months, is about 56% more effective in transmission because the mutation modifies their spike protein and increases the stickiness. So it's much more effective at really connecting with the cell receptors in your body. Well, that's what makes it more effective. But we do know that we have not seen significant increase in morbidity or mortality for the most part with the variants. We've seen a little bit of a longer duration of average 13 days versus 8 days. And we can say that's actually worse, but it's not worse disease. Now, we do know that with the South African and the Brazilian variants, there is a possibility of reinfection. And we're still following the trends to see if indeed that has resulted in increased morbidity or mortality. But for the most part, we're not going to get more severe disease. It's just much better at transmitting from one person to the next.
Okay. So when you say it's not more, the mortality rate isn't greater, does that mean it's roughly the same?
So when you look at the numbers from particularly the UK, where they had the most experience with the B.1.1.7, there wasn't a significant difference in mortality before and after the variant became the predominant variant. So we're still following that across the world because if you think about it, these are spreading all over the world and we'll get more information over the next few months.
Sure. Sure. All right, let's see. Do we have any other questions? That's all the questions that I'm seeing. Did you have any other thoughts based on what we've talked about that you'd like to share?
Well, I just have a couple of thoughts that I would like to share with all of us. One is, it's been a long haul. We've been at it for over a year now. We've gone through some difficult times. If you look at the amount of knowledge that we have now compared to the amount of knowledge that we have now, not only about the virus, but about treatments, about vaccines, about testing, about public health measures, we have made an incredible progress in that short amount of time. And things are improving. And if we remain diligent, things will continue to improve. And even if the variants do cause some increase, we'll be able to manage that going forward. So I want us to stay positive, stay focused, and stay diligent.
Well, Dr. Velázquez, thanks so much for your time today. It's great to see you. I'd shake your hand if it wasn't socially.
Which we're not allowed to do. Good. See, I was testing you to see if you knew that. So thank you very much. I appreciate that. I appreciate the opportunity. And thanks to everybody in Spokane for your hard work and diligence. We'll get through it. And I think 2021 will be a much better year than 2020, and 2022 will be a much better year than 2021. That's for sure.
Oh, that's great to hear. Well, thanks, Lee, Jan, and Nancy, Sulani, for your questions. Sure do appreciate that. Thanks to all of you for tuning in today. Please join us next month when we have Keonta Duncan from the NAACP Spokane chapter joining us to talk about diversity and inclusion in our community. And that will be March 25th. It's a Thursday around 4 p.m. Great time to tune in. We'll sign off here for the evening. Be safe, and we'll see you soon.